Are you gonna announce each week like what we're gonna be doing, or should we just?
I will try to follow the calendar the best I can.
Okay.
I will post announcements like sometime before Monday. I'll say this is you guys know for quiz 1 it's gonna be whatever content we covered today.
Yeah.
But I will still post an announcement and say quiz 1, this content. Exam 1, for exam 1 will tell you what content, what chapter, all of that.
Okay.
Does that help?
Yeah.
I probably won't post before class every week.
No, that's fine.
I try to stick with my calendar as best I can.
Okay, yep.
Okay. I just opened growth and development immunization campaign, which is stuff we will focus on next week. These are vaccine schedules if you are a visual person. Do not stress yourself out. Try to tell you what you need to know when you do the immunization. Okay? I expect, because sometimes I even have to pull out the schedules, if somebody's off the schedule or they're on an alternate schedule, we rely on these resources as well. So some things I will expect you know from memory, other things I won't. And I will be very clear. Okay? This is all just extra for you. I don't cover it. It is just extra developmental stuff if you want to look into that. I do want to make a caveat here. The CDC has changed some of the developmental milestones since COVID came out. So it may be different than our textbook. So what I teach in class, what is in your textbook, is what you will be tested on. The CDC is a great resource. However, when it comes to developmental milestones, all of that has been changing and shifting since COVID. Kids are doing certain things later, so on and so forth. So for testing purposes, textbook and lecture. Okay? Clear?
So you won't test us over any of that, that's just to give us more like
Additional resources
to further our education.
Okay. Yep. This is just about starting solids. This is some child development stuff. These are just blank grids. So we will talk a lot about growth and development, fine motor, gross motor. These are blank grids with ages. So you should be able to tell me at 15 months a kid can do X, Y, and Z. At 12 months a kid can do blah, 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 blah. These are just ways for you to practice, because I have students sometimes that are more like, okay, maybe I can read it and I can do it, but when you print that sheet and it's blank, I just freak out. I can't do that. So I just try to give you alternate ways for people that learn differently. Okay? That's the quick gist. One other thing I can tell you. Those of you that are coming to PEDS first, all of you, your community Dropbox is open. If you click this open, and you're going to do community service, you can print this form, and the person that you're doing community service with can fill it out for you. You can then upload that document to the Dropbox. Okay? What do you have to do before you complete community service?
Is that the form that you want submitted, or does they give you one?
Okay, yeah, some students will submit a picture from a blood drive of their little app or whatever. That's just for students who maybe don't have anything. This year, for those of you that are coming to NU first, this is something that's on the honor system. You click here, it's a sheet, it tells you, oh, there you go. You go down to nursing student, you are expected to complete these 4 training modules. There's nothing you print, there is nothing that you give me. I will never know if you don't do it, other than you will be clicking around at clinical and have no idea what you're doing, so it will be pretty obvious. Okay? So that should be completed before you come to orientation on your first day at the hospital. Fair? Okay. There is no computer training when we get there. So if you haven't taken the time to do it on your own, I'm not going to sit there all day and show you where you need to go to do stuff. Okay? And then, Harriet Lane will be a wonderful, beautiful resource for you medication-wise. You will want to download this to your iPad, your phone, whatever you are bringing to clinical with you, because this gives you pediatric dosing you are not going to find in your Davis drug guide. Okay? If you click on this document and push Control Find, you should be able to type in medicines that you're looking for, and it will give you kid dosing. Would have been helpful on your med profile. It's posted.
I was just thinking.
This year is a report sheet. I will give you a copy on your first day. I just included extra, included on your extra. If you like it and it works for you, it's a resource for you to print through the clinical. Okay? And then this is where your paperwork will be once I edit it to the things I want to change this semester. Cool? Question? All right. What? Rock and roll. I got you till 30 minutes, right? Let's talk about next week first. I'm supposed to be here at 9:30, correct? September 1st, 9:30. Would you guys rather start a little bit early or stay a little bit later?
Start early.
Okay.
Stay, right? I said start early.
So, like, what time are we?
The first?
Yeah, don't freak out. Thank you. What if we started at 9 and ended at, let's say 3:30 at the latest? I probably won't need you that long. I'll probably have you out here soon. Is that gonna be an issue? Speak up.
Is it 40 on 320?
There's a folder at 3 and 3:20, but we will adjust that accordingly. It's okay. You wanna come at 9 and see how far we get?
Yes.
But we have to get through all of the stuff covered on that day.
So we will leave here no later than 3:30, or leave at 3:30.
No later than 3:30. I don't think it's gonna take that long. Okay? No? Speak up? I'm open.
It's gonna be fine, I can push back work a little, 30 minutes later,
No, it's okay. What time do you have work?
3:30, but it's okay.
Okay, how about 9
I
to
just
3?
told, no, I just told them.
9 to 3.
Okay.
Are we on board for 9 to 3?
Yes.
Is that okay for everybody sitting in this room? Robin is the only, Maya, you're not nodding your head? Is there gonna be a problem?
No, I'm gonna be here anyway.
Is that work for you?
Why are you asking me?
Well, you didn't nod your head. Everybody was kinda nodding.
I felt
That's
like I was
fine.
nodding my head.
9 to 3, if we get done early, you will be out of here early. Deal?
Yep.
Okay, moving on. Let's fly through this because I touched on most of this today. Okay, you're welcome. I'm going to skip this slide. What do you think that means? Don't look at it. Look at it, but don't.
We already went
Okay, we went over some of this.
I didn't
But
want to
it's
look at
not gonna be high priority, meaning I'm not gonna recover it right now, okay? Lines are as long as they're long. Okay, I do wanna talk a little bit about respiratory adjustment. So what do you guys know? Respiratory wise, we talked about the normal ranges that you're expected to know. We talked about sucking their nose and their mouth out when they're first born. What other things do you see them do to help a baby respiratory rise when they're first born? Okay, rub them, pat them, kind of just stimulate them to get them breathing good. What else? Suction, good. What else?
I was hit when I was a baby.
What do babies do? They cry. That's a beautiful thing for the respiratory system. Why?
Because it helps push the fluid out.
Okay, so it helps those alveoli in the lungs open up, right? So crying is a beautiful thing. We want a baby crying when they come out. What about when they are passing through the birth canal? Right, that squeezing sensation to help get some of that liquid out of their lungs is a beautiful thing. Okay, good. Let's see. Talk about suction. What do you guys know about surfactant?
It's what makes
adequate surfactant for lung expansion, correct? So babies that are born premature, we often give them surfactant, steroids, those types of things, okay, good. What about pauses and rest, what about apnea? If I say the word apnea, what does that mean?
Softness, breathing, or period.
What period? When can I say a baby is apnea? Okay, it's pauses in respiration longer than 20 seconds. That is when we can say a baby is apneic. Do babies have weird breathing patterns?
Yes.
Breathe, 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 stop. Breathe, 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 stop. Normal, that's normal breathing pattern for a baby. It becomes abnormal when they stop breathing for longer than 20 seconds. Okay, that's called what? Are they abdominal breathers? Yes.
Yes.
Okay, do you guys know what that means? So their chest and their belly rise when they're breathing. Okay. What if I said acrocyanosis? What does that mean? Okay, acrocyanosis versus central cyanosis. How about that?
Acro is high.
Okay, acrocyanosis, hands and feet kind of have that bluish color. That can be a normal finding.
Which one?
Acrocyanosis. Bluish tint to the hands and the feet. They have an immature vascular neurosystem. It can be a normal finding. It should be something that you plan to document, yes, but it can be a normal finding, okay? We worry about central cyanosis, blue lips, blue mucous membranes. That baby is in distress, okay? They may have acrocyanosis to their hands and their feet, and the rest of the color of that baby is beautiful. Does that make sense?
Yeah.
All right, let's move on.
That one's central
Oh, yeah,
Needed for lung expansion.
Okay, we talked a little bit about murmurs. What do you remember? What can you tell me?
Some are limited to 6 months.
Most of them resolve by 6 months. When do I get worried about a murmur?
If there's extremity, the color changing extremity.
There's other symptoms present.
Okay, other symptoms, sweating with feeding. They don't have, first of all, babies with acrocyanosis, that is normal, when their hands and feet are a bluish color. They will have good capillary refill. Someone with a murmur that is worrisome may have irregular pulses. Pulses may be unequal bilaterally. They won't have good capillary refill. They're gonna sweat with feeding. They're gonna have apnea spells, those types of things. Those would be concerning babies with murmurs. Clear? Okay. How would I know, I just told you a bunch of the answers, would I know a baby has a cardiovascular problem? Okay, what else? Do you think their heart's gonna be beating slow or faster? Faster, so they may have that persistent tachycardia. So you're gonna know your normal range, and so tachycardia would be above the high limit, correct? Their pulses may be unequal, they may have bounding pulses. Color's important. What kind of maternal history might be important? That might indicate a baby may have a cardiac problem. Some sort of drug ingestion. Okay, what else? Okay, maybe a family history. Maybe mom did drugs when baby was in mom's belly. Maybe mom has a metabolic disease. Maybe mom has a history of rubella. If mom had rubella when she was pregnant, that baby needs to be screened very closely, okay? You guys know where to find the point of maximum impulse? So the point of maximum impulse is also the apex of your heart, correct?
Yeah, it's the midline of the clavicle, 7.
Fifth,
Sorry.
and it will actually be on a little baby, it's probably gonna be around the fourth, just so you know, okay? What is this called, mid-clavicular line?
Yes.
I talked about knowing convection, radiation, evaporation, and conduction, did I not?
Yes.
We talked about ways to keep the baby warm, we talked about, reasons that babies lose heat, correct? Okay.
You wanted us to know one example of each.
This exact picture's from your textbook, so I thought you
Okay,
got
got it.
that portion. Okay? What did I tell you about the avoiding?
Within 24 hours.
First 24 hours, that baby should keep. When am I gonna start getting worried?
Like by 12 at least, 8 to 12.
Probably, yeah, but nobody's gonna freak out until it's been at least 24 hours. They need to pee within the first 24 hours of life.
And so, okay, I'm sorry, I wanna make sure I'm clear. Baby should be within 12 hours or 24?
24, start worrying because if they're going 12 hours.
You
No,
need
you
to
start
start,
to worry about it.
you need to start anticipating that concern. If that baby does not pee, if that baby hasn't peed in 12 hours, I'm already gonna have it on my radar, I'm worried. Why are they not peeing, are they not eating enough, what's going on? But probably no intervention probably is gonna be done until they have a pee at that 24-hour mark. Okay,
And then normals.
yeah, probably IV
6 to
fluids, we're gonna make sure that your woman's paging, I mean, they're gonna do a whole. What did you say, Stephanie?
Normal is 6 to 8 a day.
Yeah,
For that.
you gotcha. Okay, moving on, what is this? Okay, you guys learned about meconium, when should they pass it?
The first
48 hours.
Okay, when do I become concerned? Red flag, 48 hours, if they have not passed meconium, red flag, what are the 3 things you're worried about, you're gonna review, if you don't remember.
The rectum cannot be.
You're gonna review if you don't remember.
Intestinal problem. Intestinal problem.
If it's not.
If they ate. No?
CF, Hirschsprung's, intestinal blockage, or.
Oh, yeah.
Right?
What was the first one?
Cystic
Cystic fibrosis. I was like, yeah, I remember now. I'm sorry. I just
Okay,
didn't see
I
it.
said, good, I'm thinking, did you write this down earlier?
Yes, I did. I'm just writing it again.
We talked about vitamin K. How often do babies need fed?
Every 2 hours.
We talked about hyperbilirubinemia, correct?
Yeah.
High bilirubin, we talked about what bilirubin is, why that builds up in the body. We talked about breastfeeding babies with that. We talked about them being assessed by their risk, low, intermediate, high risk. We talked about putting them on lights, what we need to protect against, what vitals we're watching, we talked about all that. Okay? I didn't talk about hypoglycemia. I did very little. How do I get a baby's blood sugar up? Feed them. Great. I did talk about that maybe, okay? What would be signs and symptoms of hypoglycemia?
Just give us a piece of candy.
They're gonna be more lethargic.
Lethargic, they're not gonna feed well, they're gonna maybe be kinda jittery, they're gonna have temperature issues, you may start to see some respiratory issues, okay? What about iron? Can we talk about iron? What's the best way to feed a baby? What are they gonna say? Breast milk is best. Formula is a great way to feed your baby as well. They both have iron in them. Breast milk typically has better iron than formula. Okay? Some babies will get iron supplementation, and we'll talk about that later in this semester. This is that risk zone I was telling you about. So I don't expect that you know this, it was just a visual for you. But how many hours of age they are, what's the bilirubin level you get back, you kind of follow it across, and it will tell you if the baby is low, or in the, low intermediate, high intermediate, or high risk, and then that will determine whether a baby is hospitalized, okay? we get bilirubin out of the body?
Poop.
They poop it out, right? So what would be some important teaching for a mom who's taking a baby home that has a high bilirubin level, but not high enough that they have to be hospitalized?
Make sure you
Feed
Make sure you're waking baby, even if they're sleeping, to feed every 2 to 3 hours. What else can they do? Or do they need to do?
Check their diaper for
We-
live parents.
You need to keep track of how many wet diapers and how many stool diapers they have until I see you again. What else can they do? Yeah, put them by the window. Now don't just take them out for hours, but just sunlight is a good way as well to help decrease that load. Okay? Alright. What if mom is breastfeeding, only and her milk is not in? What might we suggest she do in order to help get the bilirubin excreted from the baby's body?
Supplement.
Sometimes we'll tell moms to supplement with formula until their milk can fully get in. So that is important to know. Okay, babies, as you know, under 8 weeks, if they get a temperature, we become very concerned. Why? Okay, infection. Why? They don't have their vaccine series, right? All they have is that, they kind of get the antibodies from mom, usually starting about 14 weeks in mom's belly. And then it increases a lot during that 3rd trimester, but that is what the baby's born like, whatever antibodies you gave them. They aren't able to get their vaccines until usually a full series, 2 months, right? So we are very worried if a baby under 8 weeks that gets a fever, because it could be a magnitude of things. So if a baby comes into the ER and they have a sky high 102 fever, let's say we swab them, COVID is negative, influenza is negative, RSV is negative, we do a urine culture, it's negative. You can expect that baby's gonna probably get a lumbar puncture, they're probably gonna get blood cultures, they're gonna get everything swabbed and tested, because we need to know why this baby is so sick, okay? We treat moms for group B strep, correct? So during pregnancy, I don't remember what week, you guys will learn that in a week, but they will swab mom to see if she has group B strep. Because if baby gets group B strep when passing through the canal, what can happen to baby? They can get meningitis, they can get pneumonia, they can get really, really sick. So that's why sometimes you'll see moms get that antibiotic in labor to help protect baby, okay? What are signs of infection in a baby? So temperature instability, remember I told you they can have a really low temperature or they can have a really high temperature. These are gonna be lethargic, they're gonna be irritable, they're not gonna wanna feed. They may have decreased reflexes, they may look pale, they may start to have some respiratory compromise. They're just gonna be acting not normal. Alright, let's see. We talked all about skin. I know I already talked about all of these beautiful things. If you don't remember, you're going to review, okay? I know we talked about Caput succedaneum and septal hematoma. We talked about ortolani, we talked about Barlow. Yep, I'm moving on. We talked about reflexes, correct? We talked about APGARs, we talked about taking vitals, weights, lengths, head circumferences. We talked about immediately eye prophylaxis, vitamin K, Hep B. I know we talked about this slide in depth. Anybody have?
Gestational age.
Do not stress yourself with that. Okay. When does a baby double its, when should a baby be back at birth weight?
After 2 weeks.
When should they double their birth weight?
Careful.
Okay, when, should their birth length increase by 50%? When should it? When should it double?
4 years.
Good. Do you have to have consent to give Hep B?
Yes.
You guys all know what APGAR stands for. Why is it done in 1 minute and 5 minutes?
One is how they deliver
3 labor and then 5 is how they pay the
What did he say? What did you say?
What they said,
What they
What
said.
did we say?
first minute to check if the baby could deal well with the birthing process, and then 5 minutes to check how they're adapting outside the womb. The
Oh,
baby goes
you're
like
doing
that.
good. Okay, birth injuries, we talked about subconjunctival hemorrhages. Remember abrasions or lacerations if they broke mom's water on baby's little scalp. I'm going to skip this slide, put a line through it.
Gestational age.
Yep. We talked about this, universal newborn screen, hearing screen, congenital heart screen. What if they fail a hearing screen? It'll do it again. So I just tell parents, it's not diagnostic for hearing loss, okay? It's just a screening to tell us if the baby needs further testing. So they will repeat it, often they'll repeat it like at the PCP follow-up appointment. If that baby still fails again, where do you think they're going? Audiology, okay? Congenital heart screening, done usually 24 to 48 hours. Remember the pulse ox, the difference, what it should be, what it shouldn't be, correct? Thank you.
So when they fail this, then they send them to get
What's no more than 3?
It's no more than
It's
saturation and then
a
a
difference.
difference.
Foot on the same side.
There's a difference of higher than 3%, then they fail.
So the hand's 95 and the foot's 90, then they fail. Cause oxygen saturation.
You want
Okay,
both of
okay.
them to be above 95%.
That's right.
What do you guys know about a newborn screen?
Scream?
Screen.
Oh, screaming.
Blood
Check your
works.
PKU.
Okay, they get it from a heel stick, they put little drops of blood, it's a state screening. So every state has a screening. Every state screens for some of the same things, and other states screen for more, other states screen for less. Okay, I don't expect that you know every single test that the state of Missouri screens for, because I don't even know that off the top of my head, okay? I expect that you know that you can explain to a parent what a newborn screen is. They're gonna do it when? In the hospital.
Before they leave.
When in the hospital?
Before they leave.
After they've been alive for 24 hours, the newborn screen can be completed. Why? After 24 hours of age, why?
Because some of what the mom has said, I guess it is like what
That's a good thought. It's because we are screening for like a bunch of like protein, digestion disorders, those types of things. And if a baby hasn't ingested enough formula or breast milk, then we can get false readings. So we wanna make sure that has been fed for 24 hours before we complete that screening, or we won't be picking up things that we need, okay? So it looks for early diagnosis of genetic diseases that need early intervention for this kid to have the most successful life that they can, okay? So, hypothyroidism, PKU, cystic fibrosis is on there, muscular atrophy is on there, SCIDS is on there, that's all I can think of off the top of my head. I tell parents, no news is good news. If you hear nothing, that's great. If there is a positive, your pediatrician will call you or the state will call you. What do you think we do if it's a very sensitive test? I tell parents that it's very sensitive. It's meant to pick up something early. So if they have a positive or a high score or a low score in an area, it will flag us. They will get a call. What do you think is gonna happen? They will repeat the test. More times than not, when they repeat the test, the level comes back normal. If it then comes back abnormal again, then you refer them wherever they need to go. Okay? Great. Discharge stuff, what do you guys know about safe sleep?
Not sleeping, not sleeping in bed.
So on their back, not sleeping in the bed with the parents, in the bassinet or the crib, no crib bumpers, no stuffed animals for grandma, no comforter, nothing extra, baby on their back in the bed, right? Okay. What do they recommend? Do they recommend baby sleep in the same room? Okay, the AAP recommends that the baby sleeps in the same room in their own bed. I wanna be clear, I'm not talking about co-sleeping. Baby is in mom and dad's room in a bassinet or in their crib for the first year of life is ideal. But they definitely recommend for the first 6 months. Why is that? It's supposed to decrease the risk of SIDS. Because if, this is how I try to explain it to people is, okay, if you're sleeping in bed with somebody, like I subconsciously am asleep, but I know when my husband gets up to go to the bathroom, but I'm not fully awake. So that's kind of the same concept, is it's supposed to help prevent this baby from getting in such a deep sleep that, where SIDS could happen. There's so much research about SIDS, I don't think anybody fully really understands it, but that's the concept, is they should hear mom and dad moving around and mom and dad getting up, but they're not waking up to that. So it's supposed to help prevent them from getting in that pattern. So first year is ideal, at least the first 6 months. Cool? Okay, what do you know about car seats?
Yes, expiration date.
Okay, they have an expiration date, they should be rear facing until the baby is 2 years old.
They need to be replaced if you're in a wreck.
Thank you, they need to be replaced if you're in a wreck. We as nurses need to make sure if we are sending a kid home, we make sure they have a car seat. I used to work in St. Louis at Cardinal Lennon for probably 6 years before I moved here. You don't know how many times people would bring their kids to the hospital and they have no car seat to go home. So we literally had people, like we had a closet of car seats that we would install and send the baby on their way. So I don't think I see that as much here in rural Missouri, but it's definitely, if you're gonna go to a bigger city, you're gonna run into those issues. So your job, and you will have to chart it, baby was returned in car seat, sent out the door with parents. Car seat, car seat was checked, whatever. So make sure you're familiar how to do that if you're planning to work in PEDS early, okay? There's all sorts of different car seats, I'm not gonna bore you with that, but 8 years or 80 pounds is typically the recommendation when kids can come out of boosters and harnesses and blah, 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 blah. 8 years, 80 pounds.
Go to a booster.
Done. Free, you're free, you get to wear the car seat though, okay? What do you know about clothing the baby?
They can have too many.
Huh?
They can overheat.
Okay, I tell parents you're gonna dress them the same as you would dress. Okay, you don't need to put 18 layers on them because it's cold outside.
Take off coats or jackets when you put them in a car seat.
Beautiful. You don't leave a baby in a big winter coat when you put them in the car seat. You're correct. Okay. You guys already probably learned a ton about breastfeeding, so I'm not gonna bore you, but the AAP recommends exclusively breastfeeding for the first 6 months of life. I am here to tell you, when you go into the hospital, or you go into the PEDS clinic, or you are going to special learning, you're probably gonna see some kids starting purees or table foods about 4 months. For Kaplan, for NCLEX, for the exam in this class, we recommend nothing but breast milk for the first 6 months of life. Okay, I'm just telling you the reality of what you will also see in the real world. Yeah, well, it depends, yeah. Some pediatricians will always say 6 months, I'm not budgeting, but you're gonna see a whole variety. But I just want you to know you may see other things when you're out in the real world. But for testing, NCLEX, Kaplan, any of that, 6 months, breastfeeding, okay? When do they go to, cow's milk? 1 year. After 1 week, great. You guys probably talked about latching and positioning. You guys are having a lactation lady come speak about this, but I'm not gonna waste any more of our time talking about that. Do you have questions for me about anything in this right now? No. What if a mom wants to formula feed?
That's okay.
Can you send her? You
No,
don't treat her any different?
no.
Okay, good. You guys know how to mix formula? Did you have that lecture yet? That was.
5 ounces of water in our scoops.
Huh?
You did 6 ounces, you do 3 scoops of formula.
Yeah.
Why everybody looking at me?
That was good. It's 4 o'clock, so I have no more time. What time am I seeing you you have questions in the next week, please email me.
9 a.m. or 9:30?
Oh, yeah.
Yeah, Thursday, we're gonna